I'm Al McFarlane. Welcome to Conversations with Al McFarlane. Glad to be here and glad to be with you, to have you along. I'm going to continue. Today is the last day of the series we've initiated at the beginning of the month to talk to people, agencies, organizations, leaders, and community about the impact of COVID-19 on our neighborhoods, on our families, and what we have done and are doing to both create and demonstrate resilience that we have to respond to the challenges of COVID-19. Not only the medical challenges, but the protocols. How do you act in a way that protects you and people around you, people you come in contact with? And then how do you also prepare yourself with information about the hopeful coming vaccine so that you can make the right decision when that opportunity comes. Well, I'm pleased to have today Stella Whitney West, a leader, elder, organizer extraordinaire, CEO of North Point Health and Wellness. She's the chief health officer for Black Minnesota, and that's putting it short because I say that because I'm Black. But the truth of the matter, Stella, you're the chief medical officer, health officer for our entire community, Black, white, Asian, Latino. You carry the torch, you lead the way, and you bring body, mind, and spirit resources to ensuring that our community is listened to, is served, and is represented in the ideation of what community is and what healthful living is. So, Stella Whitney West, thank you and welcome again to Conversations. Let me also introduce Brenda Lyle Gray, who's on my team writing about the project. And Brenda and I, along with Carmen Robles, who may join us later, and Kelvin Courier, have been executing this special series funded by the Minnesota Department of Health to talk about COVID-19, how we respond and how we move forward. We hope that this conversation has been beneficial to those who listen on Facebook or YouTube and to the stories that we write from it that appear in Insight News and on our daily newsletter, Insight Culture. And we hope to continue this because documenting our experience with vaccination is going to be critical. Stella, good afternoon and unmute and welcome to the program. There we go.
There we go. Good afternoon, Al, and let me just wish you Happy New Year. Looking forward, I think we all are, to what 2021 is going to bring us and get 2020 behind us. And thank you for those remarks. I see myself as a servant leader. I I get more out of serving. I can't even imagine doing anything else. So the work that I do in collaboration of my team, and I know you've had a number of my team members on the program, so you know what they bring to the table. But we do this out of a spirit of community, collective of our community, and of our desire to serve. So thank you for having me.
Thank you so much. And in the spirit of disclosure, I mentioned this yesterday, I'll mention it again, as it's a point of pride for me, but it's also a point of transparency. One of my daughters works for you. She's one of your managers in your call center, and we're proud of her. That's Michelle Wells, proud of her, and proud to have her on your team. I know she's proud to work there and happy to be doing the leadership work that she's doing with you and for you at North Point. So, I've got a vested interest outside of being a resident and a neighbor. And, I've got a family interest there as well. So thank you for hiring my daughter. Thank you so much.
Hey, thank you for producing such a brilliant, wonderful daughter who is excellent manager. And so I would tell you, you may want to invite her on the show sometime. We see the call center is like the first point of contact.
Hmm.
Is also the heartbeat for our organization. They are the ones that it's more than just setting up appointments for patients, but people call in because it is that first point of contact. It is that general number, and people call in looking for help. And that call center staff, Michelle, under her leadership, that really starts the ball rolling, right? And to be able to get people to where they need to be,
Mhm.
answer the questions that they need. She has a staff that speak multiple languages, so we can respond to our community in the language that best suits them. So we're really proud. So she's someone that you should bring on, right?
That's a good
In
idea.
full disclosure.
Great idea. I think I'll do that. That's a great idea. And her twin sister works for the coroner. And so we're getting both sides of this whole complex spectrum activity around COVID-19 with Shelley on the intake and prevention and awareness and service side. But the sister Christy works for the Hennepin County coroner, and she has that spectrum, that lens through which we see, the range of impacts COVID-19 has in our community. Let's talk about that. Uh, in North Minneapolis in particular, in the past several days, I have been showing the graph from the Hennepin County dashboard that showed on a per 100,000 basis the impact of COVID-19. It described the number, it's called adjusted for age, I believe, but it shows the number of infections, the number of hospitalizations, and the number of deaths. And our people, black people, indexed twice as high, I think, as whites.
Correct.
Latinos, three times higher,
Correct.
and significantly higher for Native Americans or people that were of indeterminate or mixed races, I think. And
Right.
so, what does that say for our neighborhood? What does it mean for North Minneapolis, your service area?
Well, I think what it means, Al, and we were not surprised by those numbers, the disparity, because we see it in other health conditions as well. Uh, but what it also says is that, and is one that we are focused on, is looking at, and I know that we're going to have that discussion around the vaccine, right?
Mm-hmm.
When it gets to the healing part, we want to make sure that those are the community, and the people that are most impacted are the ones that are in the front of the line. And oftentimes that gets lost, right? And it tends to be those that have the access are the ones that are the first in line. And so we know that with a epidemic, that COVID-19, this is, I would say a pandemic, because this is global,
Mm-hmm.
is that everybody has to be in line, because this is a type of disease that you have to make sure that everyone receives the vaccine, or else no one is going to be safe or healed. So we're focused on that, putting pressure on the health department. The community health centers did,
Mm-hmm.
to make sure that we were prioritized in that distribution, because of the numbers that you just expressed. That when it comes to where the communities of color were, Black, Latino, Native Americans, they're coming through the community clinics. And so we wanted to make sure that with the vaccine distribution, that we were prioritized in that first phase.
How does it look for our community and in responding? When Brenda and I were in kindergarten and first and second and third grade in Kansas City, Missouri, I remembered us being lined up on the playground for polio vaccinations. Brenda remembers, she said, being in the gymnasium for an oral vaccine. I'm not sure if it was the same thing or not. Brenda, You know, I know we talked about this
I'm
the
gonna
other day,
look that up. Yeah, I've
but
asked, but I remember us taking it and then we had a booster.
mhm.
Mhm, mhm.
And so the question is, what systems will produce mass inoculation or vaccination? Because what it sounds like right now is just like the testing, people line up one by one, they wait in cars, long lines, and I'm not sure how the actual vaccinations are going here in Minnesota. But what do you envision? What's clear from what the news reports have said the past couple of days is that we're millions behind where we should be.
Yeah.
And even the aggressive uh, 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 posture that President-elect Biden has put out of 100 million in 100 days is insufficient.
Correct.
And Dr. Fauci is saying we need to double, triple that to reach where we need to be to effectively combat the virus. So, what's going to happen in North Minneapolis? And what role will you play? And what do you want us to do as a community to ensure that the emphasis is where it should be in getting our neighborhoods safe?
Well, I think so first of all, Al, to answer your question, we know that it's been a lack of leadership at the federal level. When you're talking about major vaccine and vaccination of an entire population, you got to have a strategy at the federal level. And the leadership was just not there, and it was the same with the testing, was just not there. So um, we are looking forward to the change in leadership and the understanding which we believe President-elect Biden has, that you absolutely have to have a national federal plan in order to take on this task at this level. The other important thing for North Minneapolis and our community is that people need information, and they need information from trusted resources. Inside News is a trusted resource. You, Al, are a trusted resource. And we would say North Point is a trusted resource. So I think continually to provide information in multiple formats, bringing on people that look like the community, that people recognize, so people can um, give information that is credible, and information so that people can then make the right decision for them and their families. I never tell anybody about what they have to do, right? Because you don't have control over what someone has to do, but you want to make sure that people have the right information, and that they then are able to make a decision, right? So at North Point, the decision that we hope that the community will make is that they will want to take this vaccine, and that they have the discussion with their families. I certainly have had the discussion with my family, with my grandchildren. I had a granddaughter who's 15, and uh, she uh, she was a little bit concerned about me taking the vaccine. We were in my car, and it came on the radio, and she asked me, was I going to take the vaccine? I said, absolutely. I said, when it's my turn, I said, I would definitely. And she got a little sad that I could see that she was concerned.
Mm-hmm.
And she said, Gima, I don't want you to take it. And I said, well, honey, why? She said, well, I'm scared. She said, I don't know if it's safe. And I said, honey, I said, I believe it's safe. And here's why. I said, when you look at the option, I said, COVID-19, I said, getting that disease, I said, the numbers, we know there are a lot of people who have died from COVID. There are a lot of people who are sick from COVID. It is very infectious. That's real. That I know. I don't know about anybody who's died from taking the vaccine. I said, and I trust the science.
Mhm.
I said I have seen many scientists that are Black, that are people of color who have been involved
Mhm.
in the development of this vaccine. Many of the heads of the HBCU medical schools have also been involved. And so when you start to educate yourself about who has been involved, who has been behind the scenes and can vouch for it, that's what makes it safe. And I feel very strongly about that. And plus, heading up a healthcare organization, it'd be real difficult for me to encourage or ask other family members or other members of the community to take a vaccine that I am not willing to take.
Mhm.
So I think she feels a lot better now about me taking it. So I'm looking forward to it. We did receive our first batch of vaccines here at North Point. So we're expecting more in the next couple of weeks. So we are working on getting our staff vaccinated first, those that are the
Are
highest
you
risk.
doing that now? Is your staff being vaccinated as we speak?
Today is the first day. So
Okay.
we've got staff that are lined up and that are taking that.
Can we get pictures? I'd be glad to send a photographer up. I think it's
Yep.
worth documenting.
We would love to have you. We actually had one of our staff take some pictures today,
Great.
but next week we will have a larger shipment in, so we'll let
Okay.
you know. And we think it'd be great
Yeah.
to document and to document the stories,
Well,
because our staff is also reflective of the community.
mhm.
Um, there are members of our staff. I wouldn't say that there's 100% of our staff who feel comfortable about taking the vaccine. And so we've done a survey to find out the reasons why there is some reluctance. And so we know that we've got to provide education and support for our staff, just like we have to for the community as well. And
Mhm.
there's some people, and we've seen the numbers change over time, that as more and more people take the vaccine, more and more people are comfortable with taking it. Because there are plenty of people who said, okay, yeah, but I don't want to be the first. I don't want to be the first in line, but I want to wait and see.
I thought about so like you in my job as a communicator and doing these shows every day. I've had a chance to do a tremendous amount of research and an awesome amount of conversations, interviews with experts, people like yourself, physicians, and organizers and faith leaders, etc., political leaders. So I feel relatively well informed. I feel I am doing and have done the research, and because of that, Stella Whitney West, I am willing to step forward as soon as my turn comes to take the test. But even more than that, it's not just about me, though it is about me. It's really about our community. And I thought, you know what? I won't be able to hug my grandkids, Shelly's kids, Batala's kids, Chrissy's kids, until I'm safe and they're safe. And so that gives me all the more incentive to want to be uh, present and accounted for at the earliest possible moment so that I can reconnect with the people that I love so much that we have to be isolated from. That's a horrible thing, the isolation we're experiencing now. While on the one hand, we do it gladly because we want the safety, but it's a horrible hole in your heart and in your spirit to not be able to touch the ones you love. So I mentioned this to your colleague yesterday when we interviewed, and I don't know how we do this, but what would it take to get a group of high profile leadership members from our community to do something as a public awareness and public confidence building activity at North Point? I'm just throwing the idea out. I, for one, would stand up, and I, for one, would also call up your friends and mine who are in
Mhm.
leadership in the community and say, look, sisters and brothers, why don't we do this together with the intent of our personal responsibility, our health, but also the added intent of demonstrating how we trust the science and we trust the institutions and the health leaders in our community, and we want our community to embrace, engage, and lead the way. I don't know. What do you think about that? Is that something we think about doing?
Absolutely. So let's let's do it.
Okay.
Let's do it. And I think that North Point has a pharmacy. We have the ability of my manager, my pharmacist. We've already, and we have a team that has been working. It's our COVID response team. I think you had our dental director, Dr. Brooks,
Mm-hmm.
on, and he
He,
leads that
he
team.
was great. He was excellent.
So we've been planning for this. We've developed different scenarios. My pharmacy manager, Fu, has said, you know what? I said, what's our capacity, Fu? How many vaccines can we have stored? And he said, we can store 1,000
Okay.
at one time, 1,000.
Mm-hmm.
I said, that's it. That's all I needed to know. And there's a difference in the vaccines. The one that we certainly, just in terms of logistics and be able to store the Moderna,
Right.
is the one that is the most favorable because it
Right.
does not require that extreme
Super.
low temperature, super
Mm-hmm.
low temperature storage. And it's much easier to handle, and particularly when you're trying to vaccinate a community, you need to have the ability to be able to even to take the vaccine where people are at.
Mm-hmm.
When we did testing for COVID, we started with drive up testing in our parking ramp,
Mm-hmm.
and we were able to do that. And we want to be able to do if that is the case for the vaccine distribution, which I believe is going to have to be the case. If we're really going to make sure that we can get that to people, it's going to have to be the drive up. It's going to have to be going out where people are at, making sure that we get the whole community involved,
Mm-hmm.
the churches, the community centers, and making sure that access does not become a barrier.
Mm-hmm. That's going to be great. Let me show you an article coming up for this Monday's Inside News, and it speaks to what you're saying, and that is having our people see that we are involved in the leadership of this research. And this is a story that is appearing in the upcoming Monday's newspaper. This is Monday, January 4th. Uh, and John Harrington, right, over at the Department of Public Safety. So we're doing all we can every day and every week to keep the COVID-19 story front and center, top of mind in our community. But exactly what you said, we need to know that our people, in this case, Dr. Kazmikia Corbett, uh, developed the scientific approach to the coronavirus vaccine. We need to know
Absolutely.
that,
Absolutely.
and my job is to scream it from the mountaintops that our people are front and center, leading the research. And in this case, it was Dr. Fauci who um, who gave her the credit and noted her exemplary leadership in bringing the vaccine online. So that's wonderful, I think.
Absolutely. Absolutely. And thank you, Al, for doing that, because that's what it takes.
Mm-hmm.
Our community, our folks need to see that. And other communities of color, other communities that are marginalized, when they see that, it gives them confidence. It gives them hope that there hasn't been these shortcuts, because when the vaccine development was termed warp speed, and I thought, whoa, that's not something that I would have chosen, because it
Mm-hmm.
gave people the impression that there was the emphasis was on getting it there first, as
Mm-hmm.
opposed to um,
Getting it right.
right, making it right. And there wasn't a whole lot of focus on the science, at least what we could see from the administration. But now we have the confidence because now we see what has happened behind the scenes, behind the curtain, and we see people that look like us, scientists that were involved, and have we know our best interests at heart.
Brenda sent me after yesterday's program last night an article that I think was on NPR sometime in the summer, and the headline on the article was "Minneapolis ranks near the bottom for racial equality." And as I was, before I signed on, I was listening to a 1A program on NPR, and there everybody's talking about how COVID-19 is pulling the curtains back uh, and showing this breadth and depth of inequity, of disingenuousness in our society and in the culture. And let me just share, and Brenda, you jump in here too. But this article, I'm going to read a couple of things out of it. And here's Commissioner Tony Carter. Tony, how you doing? Thank you.
I'm fine. My apologies for being late today.
Not a problem. We're fine. So this article that was this summer talked about. It says last week we shared findings showing how the COVID-19 crisis is making racial inequality worse, and then they talked about the George Floyd impact. So it says so about Minneapolis and Twin Cities in general have some of the most abysmal numbers on racial inequality in the nation. Here's a snapshot. The median black family in Twin Cities earns $38,178 a year, which is less than half of the median white family income of $84,459 a year. Only worse is Milwaukee, next door, right? And District of Columbia is worse. So before the pandemic, black unemployment in Minnesota was historically low, but still double the white rate, right? And then it says that according to the most recent census data, the black poverty rate in Twin Cities area was 25.4%, four times over the white poverty rate of 5.9%. Twin Cities area black poverty rate is significantly higher than national black poverty rate of 22%, while the white poverty rate is significantly lower than the national of 9%. So it goes on to talk about how uh, uh, devastating the experience of being black in Minnesota is. For example, in 2019, the incarceration rate of blacks was 11 times that of whites.
Mhm.
Uh, and so I'm wondering, Stella Whitney West, and I'll bring this to you, Commissioner Tony Carter, as well. What does this moment afford us in a chance to talk about what we have always known and what we've spoken about consistently in the past, but which has been rejected, denied, ignored, and pushed to the margin by our white friends and leaders in the public and private sector? What do you think, Stella Whitney West?
Well, what I think, Al, has been, we're not surprised by those numbers, and I think that what and even before the focus on COVID-19, the certainly the murder of George Floyd, really there's so many of my white colleagues of in CEOs of major corporations. They seem to almost have this I don't know epiphany where they were just where they realized the amount of racism and the impact of the racism. And so, we were all getting the phone calls. We all saw the letters. We all saw, the commitment that was made. And so that's all well and good. But uh, can it be sustained? And what is the action going to be? And we look at that and we say that it's at the point where what type of community, when I say community, I'm saying inclusive, I'm saying the whole community. What type of world do you want to live in? So what impacts Black and Brown people, what impacts people of color is going to impact non-people of color. And more and more, it's come to the point where you cannot escape it. Minnesota was always seen because of the perception that the further north you go, right, that the further away you're going to be from the impact of Jim Crow and the impact of enslavement. But we know that that was not true, that there was racism here. There was government sanctioned covenants to keep Black people out, and that was allowed to happen, and continues to happen. They may change the wording, right, or they may change how it's done, but it continues to be. And so until we get at the base, the root of the issue, which is racism, and that we have not really had that reckoning, that conversation, and the action to reverse what has happened to our community and to our people. There continues to be um, just people want to jump to some type of solution, but not really acknowledging what caused it. And if you don't acknowledge the root cause, you never really change anything. You may cover it up, right?
Mhm.
But it never goes away. And I think that's where we have to be.
Tony Carter, Commissioner for Ramsey County Board of Commissioners, have we arrived at the day of reckoning? What do you think?
I certainly hope so. Stella put it so well. We've learned during this pandemic period of time, Al, that it is true when everybody else gets cold, the Black community gets the flu. We know that. We've known that. But with so much going on and seeing the spread from the containment, if you will, in the disparities that have impacted Black people, Native people, people of color, and seeing that spread out as hunger, as homelessness, as joblessness, as sickness, amongst all of us, we have to recognize, we're crazy if we don't, that what happens to one of us affects all of us. And our community as a whole can only be well when we realize how abnormal it is, that people of color have not been able to do well generally in this society. And I can talk about Minnesota, the Twin Cities, because I am right here. We know, of course, that this applies across the country, across the world.
Mm-hmm.
And we have to do something about it if we're to survive. We have to recognize, acknowledge, and appreciate our humanity as a people. Black people have to be appreciated. Otherwise, we all deteriorate. I mean, it does come down to that. As we look at Ramsey County and acknowledge who we are as a community, if we see communities of color not prospering, it means our entire community does not prosper and does not do well. So I think, in this period of time, by having the mirror turned around, to see the entire community and how it is impacted when there's an epidemic, in one area, the epidemic of poverty, the epidemic of joblessness, the epidemic of lack of education. When we see what that does in one community and its impact on all, if that doesn't change us, I don't know what will. Absolutely, this is a reckoning. And as we are proceeding through our COVID-19 pandemic response in Ramsey County, we're hoping to take this as an opportunity to uplift the change that we have been looking for, the change that we've been working for as a people, as a community connected together. That transformation word has to become real. Because if we don't transform the way in which people can exist as a community together, each prospering each other and sharing in what is a wealth that sits right in the middle of us, then our whole community deteriorates. So during pandemic 19, during COVID-19, I don't know why I keep saying that, you know, in Ramsey County, we were already positioning for that kind of transformation. We've been able to escalate some things in the interest of not having this pandemic rush, an urgency, simply ignore where we have been headed. We're trying to turn that direction around as we focus the mirror on businesses that need our help. And for the most part, businesses of color, low income businesses in our inner city need that help. And of course, with the George Floyd incident, that was magnified hundreds of times over. So as we see funds come in to assist businesses, we've been working very, very hard to direct those to those very businesses. As we've had the opportunity of CARES dollars, 96 million, which by the way, were drastically needed, we have spent them. We've spent them on food. We've spent them on housing. We've spent them on helping nonprofit organizations and people in our community help each other, whether it be in programs for students or programs for jobs or working to, just acknowledge that this is a time during which we can turn some things around. People aren't working, but can prepare to work in the jobs that will exist. People who were dismissed from restaurants because they closed can build their resumes to get to that next IT opportunity. So we've been working to try and ensure that we're inserting these resources where they can do most help, where they can lift people up and help our entire community. I'm sorry, I just hope that we have reached that reckoning point. But I also hope that as we get the vaccine, we realize it doesn't cure everything. And so all that stuff doesn't roll back into the place where it was before, but
Yeah.
that we're learning how to build on the changes that we've been able to accomplish in the short term, whether it be in justice system and making sure that people don't have to spend time in jail because they catch it if they're in jail. If they're not violent, if they're not recommitting offenses, they should be able to be at home, at work, with their kids, in school, whatever the case may be. But let's not turn that dial back when the vaccine comes. While we've been investing in people and in organizations during this pandemic, because we see the need is so great, let's not turn that dial back. People still won't have jobs. People still won't be able to feed their children, keep a roof over their heads. Let's make sure we're continuing to invest. So the funds we received, we've used, we need more. The federal government needs to ensure that those stimulus funds come down, that there's infrastructure dollars that people are put. I just hope we don't turn the clock back. We need to move it forward and turn it forward, and escalate all this work that we've been doing. Learn the lessons.
That's a big discussion because I was saying before you joined, Tony, that on 1A on public radio today, the discussion was about after the hopefully positive impact of the vaccination and getting, the health of the nation out of the arena of risk that we're in now. Will people say, oh, problem's over, forget about the transformative opportunities that were created by the threat and the challenge, and revert to the way things were? The way things were, meaning the unacceptable acceptance
way things
of
were,
all
right?
of the disparities that characterize our presence in this market right now. So the question becomes for Stella and for Tony Carter, where is the resistance? And what in the institution, in the nation, in the culture, represents the resistance to the transformation we seek? And how do we advance this spirit of transformation in a way that removes the fear from those who resist the change? And I'll close with this note. I talked to Brenda and I talked to Peter Hayden a couple of days ago, and he said it so succinctly. He said, uh, "My question is, what is it about me loving me that makes white people so afraid?" I said, "Wow, say it again. If black people love themselves, and this is not an anti-white at all, nothing to do with, it's about when I can cultivate a true uh, humanistic love for myself, my own identity, my own skin. Why is that feared? And why are policy and practice aligned to prevent, discourage, dissuade me from discovering me?" What do you guys think? And we're going to close with that. This can go on forever. This is a great conversation. And I thank you both so very much for being here.
Well, if I may, Al and Tony, for me, I think that it all ties back to wealth and power. If there's one thing that we all should have learned, is that after we fought so hard, right, after our ancestors fought so hard to be a part of this democracy, to be a part of the decision makers, um, somehow or another we thought that we had arrived, right? And if nothing else, we have to know that we cannot sit down. We cannot just be satisfied with one piece, and understanding, if nothing else, how quickly that can disappear. How quickly, I mean, the most frightening thing for me was to bear witness to going back to um, the organized suppression of people's right to vote, and how quickly and how so easily someone in power could make a determination around a whole group of people in a community, could just wipe their names off of the voter rolls. And we've always talked about the fact that health and well-being is so much tied to politics. Who is in power? Who are the elected officials? Who is making the decisions, the policy? And I pray that we have learned that lesson very well in 2020, and that we carry it forward when we look at what happened in this election, when we look at what was at stake, and how people in this age of COVID-19, the images of folks lining up, right? And taking their own health at risk to cast their vote, make sure, right, that the people that had their best interests, or who they believe had their best interests, were going to be the ones that were going to be in power. And we can't forget that. We cannot sit down. We cannot. We have to continue with those lessons around mobilizing. So, to answer your question, that is what they fear. They fear that because of our ability to mobilize and our ability through our voting power, that we could change who has a say and who gets what, right? It always comes down to that, to me, that balance of power and wealth.
Wow, well said.
You're either at the table or on the table, right?
Mm,
Uh,
yeah.
Tony, you're at the table.
Oh,
You create the table. You run the table. So speak to the same issues.
I'm a part of the table, and I'm fortunate to be there for such a time as this. Dr. Martin Luther King said the arc of the moral universe is long and it bends toward justice. And we know, just as Stella just said, the reason it bends is because you got a whole lot of people jumping on it and bending it.
Mm-hmm.
And that is the power that Stella is speaking of, the power of our being able to combat an inertia that has taken things in a direction so far away from health and well-being and the ability of people to be prosperous that we have got to yank it and move it. And that creates a momentum that if we can stay, if we can actually stay on top of that arc and bend it, can get us to where we need to be. I'm thankful that it's got to be us. We've got to do this work, but that there are people in our communities around us who understand for their own well-being and that of their children and our future as a collective that they've got to help us bend it too. So we're pushing against that old inertia that keeps things in place that have been as they are, because people who have power and want to keep it don't want to give up what they think is only theirs because they took it from somebody or because they're holding on to it so tight that somebody else can't get it. And they're focused on the health and well-being of their family without realizing how interconnected we all are. So yeah, we've got to stay on top of it and get in that good trouble that we've always known is our salvation. But when we look away and we're not focused, things can bend back,
Yeah.
snap back. So we've got to stay focused on that change, on the alliances that will help to work together with us, and on making certain that what's good for me is good for you. We recognize that we've got to have goals that pull everybody up. That is the way in which we'll be a healthy community, a healthy country. There's stuff happening in Georgia right now, and I'm praying, but let's see how much good work we can get done to help move that forward. And let's continue to be at the table together. I think in Ramsey County, having people from our communities more and more engaged in the work we do, helping to ensure that we understand each other's circumstances and are able to hear real people and focus on listening and doing what real people need. That's the extent to which we're going to be able, and in Hennepin and elsewhere in Minnesota, to actually change this. And that is the fear that things will change, and change they must. Everything must change.
I think that says it all. I want to thank you, Commissioner Tony Carter. Thank you, Stella Whitney West, CEO of North Point, Commissioner of Ramsey County in St.
Thank
Paul.
you for having me. Have me again. I'll be on time.
Well,
Okay.
not a problem. We need to keep doing this. So I want to thank the Minnesota Health Department for funding this series. This was simply for the month of December. Today is the last of these daily, 7 days a week podcasts with leaders in community, and they've been powerful and wonderful. And we're sharing them on Facebook, sharing them on Twitter, sharing them through our daily newsletter, sharing them as feature stories written by Brenda Gray in Insight News. So
Thank
it's
you,
been a
Brenda.
wonderful experience. We hope to continue it because really the important work is about to get underway in getting our people to understand how to make the best decisions for themselves around vaccination so that we can achieve the health that we require, that we need, that we deserve for our families and for our community. So hopefully this will go on in the next few weeks. We can launch it again and bring you all back. But thank you for what you're doing. And obviously, Insight News is at your service whenever we can be of support to the vision and the work that you undertake for our community and for humanity every day. Thank you so much.
Thank you, Al, for uplifting information through insight. We appreciate it.
I'm Al McFarlane, and again, thanks to the Minnesota Department of Health for underwriting this series. And pay attention, and stay with us as we talk about how we navigate futures that reflect our identity, our interest, our humanity, and the genius of our